So the next speaker, we're going to do 2 keynote speakers. They each have a half hour, so we will be taking a break at 10:15. A good 15-minute break. You can walk around, get outside, get some exercise. But this is a working meeting, so please don't feel like you're trapped in your seat. Get up, during, get drinks, whatever, okay? Bathroom. So this is a working meeting. No one needs to sit and stay if you don't like to talk. But the next speaker, you can't get up for. Dr. Margaret Kitt is, the essence of speak softly and carry a big stick, that's Dr. Margaret Kitt. She's the second in command at NIOSH. She's the Deputy Director of the National Institute of Occupational Safety and Health. I am really happy with my life. I like my life. I like what I do. I thought I have a pretty cool life, and I didn't think there was anyone that I'd rather be, except last night I realized I'd rather be Margaret Kitt. For this reason. When I was going into medical school and money was an object, and I was looking at the military to help out, and I thought, okay, I've always wanted to be a flight surgeon. I like going fast. I like circus rides that make you crazy. The faster, the better. So I really did think I wanted to go and be a flight surgeon because I wanted to fly. And really, when it came down to it, I was married, had a baby at the time. Commitment to military. There were some other issues. So I gave up that dream and pursued another passion. But last night I learned that Margaret Kitt was a flight surgeon, is a flight surgeon. She's an occupational physician. She flew jets. She flies jets all by herself. Fighter jets. And how cool is that? So, again, if there was one person I would potentially rather be, it's Dr. Kitt. So, Margaret, please, thank you for coming here on such short notice. Dr. Howard was going to speak, and then pretty typical, Margaret backs up Dr. Howard and has willingly come out and will really share the vision for NIOSH. NIOSH is a big funding agency for our research and for all occupational health and our Total Worker Health Center. So she's going to provide a vision and overview from that. So, Dr. Kitt, come on up.
So, as I mentioned, I'm going to talk a little bit about NIOSH and about the research that we do, particularly in the public safety sector, and some of the work that we hope to do related to corrections, as well as some of the other parts of the public safety sector. Whenever anybody says CO here, I perk up because I am also a CO, a commissioned officer in the Public Health Service, a different type of CO. So just to sort of set the stage, we get confused a lot with OSHA. We're not OSHA, we're the National Institute for Occupational Safety and Health. And we really are in 2 separate organizations. So OSHA's Department of Labor, and we're within the Department of Health and Human Services, part of the Centers for Disease Control. And we're really a research agency, actually the only government agency, federal government agency, that is appointed to do worker safety and health research. And as I mentioned, we do research related to the safety and health of issues of different workforces that I'll talk about. And we really partner with industry and labor, as well as many other federal, state, and local entities to conduct our research. And then, it's really important to work with those folks in order to disseminate our research further. We're very geographically separated all across the United States, and today we have people from Cincinnati, Morgantown. We also have facilities in Atlanta and DC, which are primarily our administrative offices, but a lot of great work that's done in Anchorage, Denver, Spokane, Pittsburgh, as well as Cincinnati and Morgantown. And we have a very multidisciplinary approach to all of our research, wide array, and this isn't certainly not an inclusive list of all the different disciplines that we have that work in our teams in order to conduct our research and the field work that we do. And we're incredibly diverse in the type of research we do, from whether it be field studies, epidemiology, laboratory studies and analysis, exposure assessment, really a focus on engineering controls and personal protective equipment. So we really have a wide array of different types of research projects. And put out a lot of publications, whether it be journal articles or technical reports. We put out alerts to certain workforces when we think that there's a really pressing issue that needs to be highlighted to different workforces and different entities. And these are a couple of the alerts and workplace solutions that we put out that are of particular interest to the public safety sector. And most of our information now is available online. We've really gone from as much paperless as we can to web, but recognizing that there are still many workforces out there that rely on paper copies, and so we try and balance all of that so we can make sure information gets to the right folks. And so how NIOSH has structured its research programs is based on the National Occupational Research Agenda, or NORA as we refer to it. And this actually started back under the previous NIOSH director, and it was based on 21 priority areas. When Dr. Howard arrived, we switched over to a sector-based approach to our research. So it's based on 10 sectors. We have the public safety sector there highlighted. And public safety was really a spin-off of the services sector. So it started as 8 sectors that spun off to 10. Services was just so big as a separate sector that we decided we really needed to carve off the public safety subsector as a distinct entity. And even so, the public safety sector is huge, as we're going to talk about as well. And then I just want to mention we have a number of cross sectors as well that really sort of branch across all the sectors and all the workforces. So the public safety sector program that we have really focuses on 5 primary areas: fire service, law enforcement, EMS, corrections, of course, is one of them, and wildland fire. And the purpose of the sector program is really to help set priorities within NIOSH and for the nation. So the NORA process is really contingent upon not just NIOSH folks participating, but all our stakeholders across the United States. So we work really hand in hand with many, many people on the NORA agenda. So it's not just a NIOSH agenda, it's really an occupational agenda for the nation. But we have our own internal projects, and then, of course, we help to fund some of the extramural projects in all these different sectors. We try and monitor, particularly the NIOSH-funded projects that are in this sector, and really encourage NIOSH as well as extramural partners to address program priorities that we set together as a team. So it's not just NIOSH setting the priorities, it's the team setting the priorities, which is both NIOSH and external partners. And then we try and track projects and impacts from the efforts. So, you all know much more about some of the next few slides even than I do. This just gives you sort of a breakdown of some of the populations according to BLS, the numbers of workers that are involved in some of these different areas. And I obviously have correction workers highlighted there. And so we present this information to our public safety council, sector council. And the folks that sit on that council are really, as I've mentioned, a wide variety of folks. They're from academic universities, from businesses, from professional societies, from government agencies, of course, and then certainly labor and worker organizations are a big part. NIOSH is set up on a tripartite system to make sure that we include both labor and industry as our partners. Identifying the needs of such a diverse sector and how to prioritize those goals is a big job. And then, we support research both internally and externally as well. And so, I mentioned those areas of the public safety sector that we focus on, and there's really, of course, cross-cutting issues across all of those areas. These are some of them, the acute and chronic diseases that are applicable to these different parts of the sector. Vehicle-related injuries and fatalities is a big part of every sector, unfortunately, that we deal with. Musculoskeletal disease, cardiovascular, infectious disease, stress, and then, collection of injury and illness data. So those are sort of the cross-cutting issues across the entire sector. And we have a lot of projects that are ongoing right now related to the public safety sector. You're going to hear in a little while this morning from Oliver and Jean about a proposed study on integrating safety and health programs for correctional workers. We've already heard several times the BCOP study mentioned, and this is a tremendously successful partnership that we have with John, NIOSH has with John, and it's just been a phenomenal project that's really going to produce huge dividends for years to come. So. We have some work going on at our National Personal Protective Technology Lab on firefighter personal protective equipment, where we evaluate subjects that are exercising in different types of firefighter gear. And then really across all sectors, we're putting together a personal protective equipment database that hopefully will be helpful to people as they choose PPE and what the indications are for using some of the different PPE that are out there. And once again, I think you're all very familiar with some of these statistics, but we're in the process of, making sure our sector council is well educated in the aspects of correctional officers specifically. As we've focused on other areas of the public safety sector, now I think we're turning more and more towards the correctional officers, and it's going to be a focus for us in 2015. So you all know these sort of statistics about how the inmates are certainly increasing within the correctional facilities, and but there's been not really a corresponding increase in the number of employees, the correctional officers that are out there. And the job demands are really are significant. And addressing some of those issues it's been really exciting to hear some of the work that's going on actively in correctional officer workforces. It's really rewarding to hear the enthusiasm that people bring to the table on this subject. Some of the BLS statistics that are out there regarding the days away from work, and I think Mr. Morrow was talking a little bit about this as well, is that there's nearly a 4-time higher days away from work from non-fatal injuries in correctional officers than the U.S. average. And you can see that also there were almost 2,000 inmate-initiated workplace assaults reported in federal prisons in 2009. So a lot of the information that's out there is really staggering, and this is a workforce that really needs to be addressed in many research areas and projects. The fatality rate among correctional officers between 1999 and 2008 is shown here. Certainly the larger proportion is male and between the ages of 35 and 54. And as is noted here in yellow at the bottom, also the assaults and violent acts leading to non-fatal injury events, those are the leading causes as well. So taking this information that we presented to the Public Safety Sector Council, we have, we're an agency of goals, and we've got thousands of goals that we try and pare down and try and focus and prioritize on. So these were the ones that were really sort of chosen for the corrections specific goals. And so you can see, I'll just briefly read through them, reductions in injury and fatality, unintentional injury interventions, mechanisms to address aggressive inmate behavior, really simple stuff, right? So infectious disease screening and control for inmates, I have up here illness and injuries from sharp exposures to non-medical correctional personnel, but I know it's very important for medical as well as the non-medical folks. Stress, certainly, stress factors associated health and associated health outcomes, stress in the work environment, and then really collecting some good medical surveillance data. So these are sort of the broad goals that we've established. And as I mentioned, we're really looking for 2015 to be the time where we start moving more into this area and what can we do in addition to the things we've already been working on in correctional officers. We have health and wellness program effectiveness goals here to evaluate existing medical surveillance and wellness goals, or wellness programs, and to establish best practices. And we know that we'll be working with many of the partners in this room to do just that. So I wanted to mention, this is really, I think, an important time for us to be here and presenting to you, because we are trying to determine what to do in our priority structure for 2015. So I just talked yesterday to Marianne D'Alessandro, who's the manager of the public safety sector for NIOSH, and she's trying to determine, along with Paula and others, what to do for the meeting next year for the safety sector. And they're trying to figure out if there's enough material to do a full day related specifically to correctional officers. From what I've heard last night and what's today, I would say yes, but I think she and the folks that manage that program would be interested in hearing what you have to say and what should be on that agenda for their meeting next year related to correctional officers. So I think it's a good opportunity to get your input on that, because that will really help drive what happens that NIOSH really sort of advocates behind for the coming years. I wanted to mention some of the other work that NIOSH does in corrections as well, and has done historically. We have a number of documents that are out on MRSA prevention in correctional facilities, and all of this is available on the web, and I think a lot of this material is really good information to make sure we can get out there. We've done a lot of work on tuberculosis control in correctional facilities. In fact, one of the initial projects I worked on when I came to NIOSH was TB control in the state of South Carolina correctional facilities. We spent several weeks traveling around to meet with different correctional officers in certain prisons within the state of South Carolina to help evaluate their control programs for the correctional officers. Obviously, it's important for the inmates as well, but for the correctional officers. And we have a program that's called the Health Hazard Evaluation Program. Some of you may be familiar with it, where three current workers, a labor representative, or the employer can ask NIOSH to evaluate a particular hazard that they think exists within their workplace. And sometimes we go out to visit the facility. Other times we can provide information that we think is sufficient over the phone or through communications. And this is just a copy of a health hazard evaluation we did in the state of North Carolina related to TB control. I wanted to mention a CDC document that is out there on prevention and control of tuberculosis in detention and correctional facilities, and NIOSH played a very big role in developing this CDC guidance that's out there. We have some information that's out there on needle stick injuries, and I should mention one of the reasons I made sure to include this is we have another commissioned officer, Commander Harold Boyles, who was going to be here today, and unfortunately they had problems getting here. He had problems getting here from the East Coast yesterday. And Harold is going to be a really tremendous addition to our public safety sector. I think he's probably watching on the cast right now, because he was, up until January, he was a nurse in a correctional office or correctional facility, and now has come to us. And so, he has just such valuable insight to be able to lend to us as we move forward. And it's really, like I said, a good time because we're just really moving forward in 2015 as to what our projects are going to be. So he had brought this to my attention of how important the tattooing is within the prison system and the hazards that it presents for correctional officers and the medical personnel that are there. So we do have some guidance that's out there as well. And we have some job stress products that are in development, a pocket guide on job stress prevention, a desktop guide for managers and supervisors, and a video that's being produced. And like I said, those should be out relatively soon. We also have an emergency preparedness and response office, and I realize correctional officers probably live this every day because they're always having to be prepared and ready for emergencies. But we do have a very active office that's taken off since 2011, and I thought this might be of interest to some folks. We have a guidance document that's called it's called ERMS for short. And it's the Emergency Responder Health Monitoring and Surveillance System. And it has a lot of good tools in there for those of you that are interested in preparedness. And it is a national response team document at this point. It was produced by an interagency group that NIOSH led. And we, in January, were asked by Dr. Howard to take our emergency response a little step further and develop a research initiative related to disaster science research. And we're in the process of developing a framework for responders and recovery workers that will bring some research into the response, the emergency response, and that's a tough task as well. But myself and Lisa Delaney from NIOSH are leading that effort. So that's sort of a 50,000-foot view of NIOSH. We're all very big dog lovers in Morgantown, as you're going to hear more about later today. And Dr. Howard found this slide for me, and we use it quite a bit. This was one of the rescue from one of the many disasters we've been involved with. So I think I'm happy to take a few minutes of questions if people have. Yes, ma'am.
So just glancing through the agenda today, and stress is a huge issue for corrections officers, and I'm a safety consultant. I've been to almost all the prisons in the state of Oregon, and one of the things that I've noticed is, for one, the ergonomics of how the control towers are designed and the housing units. I mean, there's a lot of opportunity there to reduce physical stress on the body, which is helpful. But also, are you guys looking at, educating them on what types of nutrition that they could put in their bodies to help, dealing with stress, of course, hydrating, things like that. But just the what do I want to say? The physical location of where they're working, they have to pack their food in. And, how it is when you pack your lunch. Sometimes you just throw in, not so healthy stuff. So, giving them some options and maybe even providing some opportunities for them in the facilities to purchase some things that are a little bit more nutritious. I just wondered if you've looked at that.
Yeah, I think that may be more closely tied into sort of the total worker health approach. It really encompasses not just nutrition and exercise, physical issues, musculoskeletal issues, the physical structure of where they work. All those things are critically important to sort of wrap up into a total package that can be applied to the different facilities all across the United States. So yes, but it's, I think for us, we're just beginning to, NIOSH is just beginning to package that better now at this stage. But all those are certainly really important. So.
Yeah, I think that's the unique challenge is, we've worked with firefighters, we understand fire well. They get to cook together, exercise together, shop together. You can make some great changes there. In law enforcement, there's a few more challenges in terms of, but they get to eat out. They can choose Subway. They can ride in the patrol officer. Corrections is a very unique challenge because of the confinement, the environmental challenges. So you're right, and that's the reason for this meeting, is to understand those challenges better and then actually do research intervention on this uniqueness of this worker population.
And I think there's things that can be adapted from other work that's been done, but then making sure that you adapt it in the right way for that particular worker population. So.
I'll just make a comment on this. That part of the project we're doing under High Tech 2 involves 4 themes with the Kaizen team, and one of them is a nutrition and health theme. And right now the Kaizen team is going through this whole exercise we're going to do this afternoon, and has come up with a variety of different approaches to try out. And that includes everything from catering in to also to just home eating, and it overlaps with the sort of eating and stress. So the group is working through it. I can't say we, because they're well on their way. And again, when we have some outcome, if particularly it works, we'll be glad to share it.
Great. We'll be sharing some of those programs this afternoon as well. Leslie?
So in Oregon, Charlotte Fritz and others are... Hi, in Oregon, Charlotte Fritz and myself and others, as part of a pilot project with the Total Worker Health Center, are conducting an job stress intervention project focused on supervisors. And I'd be really interested in getting my hands on the customized job stress products that are going to be coming out. Are those being developed internally or externally?
They're internally being developed.
They're being developed with, I believe CPHU helped in developing that.
So it's part of it. So it's in conjunction with Martin's work. And
Do you know, Paula, when those are going to be ready?
I think what's holding up right now is just getting the video in the state to be put up on the website.
Okay.
so, Paula, you'll be the
Yeah,
contact.
Sean Roberts, and
Okay. So I'll be in touch with you guys. Yeah, we'll be in touch with you guys. Great. Thank you.
Okay. And well, thank you again for the opportunity. I appreciate it. And we really want to hear your thoughts. So thanks.
Great. Thank you.